Hey, this is Andrew Lee, your health insurance guy, and I just wanted to make this video here today about the annual election period. Now, what is the annual election period? The annual election period is when seniors can apply for Medicare Advantage policies if they haven't had one, if they're on original Medicare, or if they want to switch their Medicare Advantage policy or their prescription drug plan. Now, this period starts October 15th. There is also a period called pre-AEP where it's from October 1st to October 15th where we can take a sneak peek at next year's plans, but the actual enrollment period will start October 15th and it'll end on December 7th of every year. Now, sometimes they could have an extension just based off of whatever they come up with at CMS, right? If there was some kind of maybe some kind of FEMA disaster, or if there were some kind of glitches with their system, their enrollment system, then sometimes they will allow a couple more days, but do not take my word for that every single year. I just wanted to let you know a little bit more about how this all works. So it's officially October 15th to December 7th to make that change. Now, some other timelines go as such. We have the OEP period, the open enrollment period, where you can go ahead and switch one time from a Medicare Advantage to another Medicare Advantage. And the point of doing that is because some people during the annual election period could have enrolled into the wrong policy or some call center, or some weird scam or just rogue agents, which, independent agents like us, we detest because they give us a bad name. If there were a situation like that, then that period is to switch over the Medicare Advantage plan. If you did go with a Medicare Advantage plan option, that period from January 1st to March 31st is when you can make that one-time switch. Throughout the year, there are going to be special enrollment periods, but I want to focus on the annual election period. So, the annual election period, again, is where all the magic happens. This is when you're getting flooded with mail if you're a senior or on disability, mail, TV commercials about $0 this, $0 that, and a bunch of phone calls from overseas or even, just something you maybe opted into 2 years ago and finally they have your data and are now spam calling you. So one big, big, big tip I will give you is work with an agent that you actually trust and that you actually can gel with and know that they're actually an agent, not just somebody at some call center or some kind of untraceable number or scam or whatever the case is. That there's a lot of that going on, especially with the advent of artificial intelligence with AI. So just please, please, please watch out for that. If you have any questions, of course, reach out to me. I'd be more than happy to give you a human touch on what you're actually needing and customizing your plan for your actual usage and what you're actually going to need it for. So I'm going to give you some tips on how to tackle AEP the way we're supposed to and get you the plan that you deserve. So, one suggestion I would give is start early. The 15th of October is when the floodgates open, but start early because at that point, then you can see which doctors are going to update, their plans for 2025. Some doctors are still in the process of updating that on Medicare.gov or any of these carrier websites. So you definitely want to start early so you have peace of mind knowing that you're enrolled into the plan that you now want, starting on January 1st. So please start early. Please review your coverage in full detail with me, and I will give you, multiple options as to what I think would work out for your situation. But in this scenario, I would personally recommend starting early instead of being, you know, in December, the first week of December and just in a frenzy. along with millions of other Americans. So you don't want to be in that position. So start early. That way we can have some wiggle room if we have to change anything. Now, every year, as anybody on a Medicare Advantage plan or a prescription drug plan standalone Part D, they know, you guys know that plans can change every year and doctors can leave medical groups and medical groups themselves can change with the carriers. Now, there's a lot of moving parts to that, and I know that subject can get a little bit complicated, but if you guys were ever in a situation where a doctor left the medical group and all of a sudden your insurance that you were using is not eligible to use with that medical group or that doctor, guess what? We're in trouble, right? And then we have to reshop for another plan, or at the very least find another plan that is going to work with that doctor if you are married to the idea of staying with that doctor. Because say if it's a specialist that has saved your life, one time, two times, three times, whatever the case is, if this is a person that's life or death and you need this person, right, we have to find a policy that this doctor is going to take. So this is a huge, important, one of the motivations of reaching out to an agent like myself to do a needs analysis, because you just don't know. One day you're going to just wake up and find out that your doctor doesn't take your insurance all of a sudden when you have to go. So just please, 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 I would recommend just double checking during this time. It does not hurt. I would also suggest utilizing Medicare Tools. You can obviously do that on, government sponsored websites like Medicare.gov, but also have somebody to hold your hand through that. We can look at this together. So basically, what we do at our agency is we make sure, again, that your prescriptions are going to be at a pretty good amount. And we're going to find a carrier that's going to have your prescriptions at a very low rate. So, what we want to do is find out which plan is going to have the lowest rate for your medication, and if it's going to be a tier lower on a certain carrier, or if that medication's even covered on the formulary in the upcoming year. Definitely want to take a look at that, but definitely do it with a professional, right? Let's look at this together so that we know, what we want, but at the same time, we can chime in as brokers as to the pros and cons of what that carrier or situation or plan would entail. Another tip, again, I'm going to sound like a broken record, but please consult an expert. And then we've been doing this, our agency has been doing this for 10 plus years. So we know a thing or two about this topic. But please consult a broker that you trust, and just, again, somebody that you gel with, somebody that that will take care of you and that that they know their stuff, right? And once you have an agent, they don't necessarily have to be too local, but at the very least, you'd want to find an agent that knows the doctors in the areas, the medical groups in the areas, the hospitals in the areas, the doctors' offices in the areas. Just little minute details like that could change your whole experience with your insurance. So please, please, please run by any questions you have about a specific carrier, about a specific rule that Medicare enforces, whatever the case is. Please reach out to an expert like myself, because one, it's free to work with us. There is no fee to work with us, right? We basically get credit from the carriers as to whichever carrier you go with. That's why we're brokers and we're not really biased on which carrier you go with. We're going to get you what's going to work for you, and we get credit for helping you out, because at that point, now we are doing their customer service on their behalf for you. So that is our role. Once you enroll with our agency, you have lifetime service with us and our team, right? So that's another pro to working with an expert, but at the same time, you would want some kind of game plan. You would want somebody that just knows, again, the moving parts of what's happening with the following year. So highly, 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 highly recommend consulting an expert, right? If there's something that you can't do, like for me, I have no idea on fixing cars, right? I'm just gonna go out and admit it. I'm not good with cars, and I have to delegate that to somebody that is an expert on my car. So same deal, except for you don't pay us. Another tip I want to give you is make sure we're budgeting for 2024. As you guys know, if you guys are seniors, I mean, every penny counts, especially these days, especially these days. So make sure you're budgeting for the following year as well. And you can do this also with the help of your insurance, right? Some plans would offer financial assistance with your Part B premium. Some would give, flex cards for groceries or utilities or any, there's a lot of additional benefits that you can receive with certain policies. So let's factor that in our budget. And also, if it's going to help out with your utilities, if it's going to help out with just your day to day, heck, it's very much worth looking into. So, I would also definitely recommend looking at the monetary aspect of your plan. How much is my copay this year for my doctors? Is it still zero? Is it $5? Is it 25 now? How much is my premium now for this plan? Is it zero? Is it turning into $41 a month? All of that can come as a surprise, especially because for seniors, when seniors wake up, the first thing seniors think, it's not going to be, hey, I need to tweak my Medicare application today, or I need to call my insurance agent. That's not top of mind. It's like sort of going to the dentist. It's something you have to do, but just sort of, I'll get to it when I get to it. So this is the time to do this. So please, please, please reach out to us so we can come up with a budgeting game plan as well too, because there could be plans with lower out-of-pocket maximums, and that's of course the amount that you pay if God forbid worst came to worst. What is my bottom dollar? How much am I supposed to owe to the hospital, to the clinic, to the lab, right? So all of that, we definitely want to also factor in as well too. So budgeting is going to be very important in this process. So another tip is the obvious. Please enroll before December 7th. Like I mentioned, sometimes they do give out extensions, but do not hold my word for that every year. I'm just telling you what I see as a broker. But on the 7th of December, midnight is when you can submit your last application for the annual election period. So please, please, please make sure you finish your application or your agent finishes your application before December 7th. And once you have the plan that you now want and it kicks in on January 1st, make sure you read over your summary of benefits. Make sure your agent is following up with you. We do that too. Me and my team, of course, at the very least, reaches out and text messages you to make sure that everything has gone pretty smoothly and everything is copacetic and you have peace of mind that you are now on the plan that you now want. If there is any issues, if there's any concerns, if there's any changes that might have happened, you consult us. That is what we are here for. So those are some tips to have a great AEP. And if you guys didn't work with an agent before and were sort of apprehensive, hopefully this video has illuminated some of those apprehensions. And also, hopefully you guys have learned a thing or two about if you guys are autonomous doing this yourself, which again, I would not recommend just because there's a lot of moving parts with Medicare. But if you're autonomous and you've learned something from this video, I also appreciate that too. So, guys, thanks for listening and please like and subscribe for more of this content. I want to put out more important content that I'm keeping close to my chest right now that I will post. So please, again, like, subscribe, and comment to this video, and we'll bring you some good stuff. Thanks for watching and have a happy AEP.